So when I think about patients with MPN, which is particularly relevant for those patients with PV and ET, I really think of those conditions as another cardiovascular risk factor. And so patients that have cardiovascular risk factors need to manage those risk factors to prevent outcomes such as MIs, strokes, et cetera. And so patients that have those risk factors already really need to work very closely with either their cardiologist or their primary care doctor to manage those risk factors, because those risk factors will also influence the risk of having a thrombotic event in their MPN. And so when they have those diseases, it's really important to make sure that their blood counts are also really well controlled to prevent those thrombotic events. Now, when it comes to pulmonary hypertension, we're still learning a lot about that. So we have known for a while that patients with myelofibrosis can develop pulmonary hypertension, and we have studied with Dr. Leva and others that patients with polycythemia vera and ET can also have pulmonary hypertension. And really, it's not something that we routinely screen for in patients with MPNs, but perhaps it's something that we should. So some of our studies have indicated that pulmonary hypertension doesn't just have the complications of pulmonary hypertension, but may also be a poor prognostic factor for progression of disease. So I think we're still learning on how to incorporate pulmonary hypertension into our algorithm for diagnosis in our patients and for their management.